AWS offers in-home services through two key programs: Infant and Toddler Services and HomePoint Healthcare.
The infant and toddler services is birth to 3, and then the home health services are of all ages, but primarily we do services for the young, birth to 18.
AWS has been an early intervention provider in the state of Indiana since 1996. Early intervention provides services for children birth to 3, and our staff provides everywhere from physical therapy to speech therapies, behavioral psychology, nutrition services, a broad array of therapies to families and children. When a family comes into the early intervention system, of course, they have all sorts of questions about their children. What is wrong? What is going on? Why have I been referred to this program sometimes to start with? And so our therapists are able to go into the homes and help those families really kind of come back down to the basics and figure out this is what we need to do. These are the steps that we need to take to help get your child developmentally back where they need to be.
The services that my son received through First Steps, he received developmental therapy for speech issues. He was not talking very well, or not using words at all, really, when he first came into First Steps.
I think a typical response from a family when they come into the system sometimes and they've been given a diagnosis, their child has been given a diagnosis, even if it could be a diagnosis of Down syndrome, or it could be just something as simple as your child has a speech delay. And of course every family stops and looks at that and says, but that means my child isn't what I thought they would be. They're not developing in the typical manner that I thought that would happen. And that's scary. It's scary for a parent to hear that and then to know what steps do I need to take. And so a therapist comes in, and though they don't have a magic wand to wave and say, okay, now everything is fixed, you're all good and can go about your normal activities and routines, the therapist can come in and just say to that family, I'm here, and together we can do this.
About 6 months later, when he finished receiving services in First Steps, you can't get him to stop talking now. This is an amazing program, and it's parent-friendly, it's family-friendly, and it's probably the best thing they could ever do for their child.
Our other home-based care program, HomePoint Healthcare, offers in-home skilled nursing and daily assistance services.
We provide anywhere from 1 hour a day to 24 hours a day. We want to be as least intrusive as possible, but yet give medically ordered care in the home.
We are the doctor's representatives in the home. The doctors have the orders that they set out for what they would like to have done. We go for the extra accreditations and want to have our standards higher because we feel that the clients that we serve are very, very important, and they deserve the best that we can give them.
From birth through the end of the spectrum, and I think that's what AWS offers. We're constantly developing and honing in on what the public wants, what the parents want, what the community wants.